One of the important parts of understanding how drinking affects men is to look at the biology. We do know that approximately 60% of the alcohol propensity is inherited in men and probably about the same in women. So most men tend to start to drink early. They tend to drink around about the age of 19 being about the peak. But by the time they arrive at treatment, it is usually about 20 years later. Now, there are some men who start to drink much later on, people who are under considerable stress, are businessmen, familial stress, or stress due to economic and other factors. That tends to occur in the late 30s or early 40s in men and usually progresses along with mood disorders such as depression and anxiety. So basically, you have two types of disorders that affect men in terms of alcohol. One, which is probably more biologically driven by familial factors, paternal factors, and genetics. And a second that is probably more related to the development of alcohol use disorders out of habit, psychosocial circumstances, or mood disorder. The first thing most people notice in terms when they start to drink more heavily is that their sleep becomes disturbed. They tend to sleep less, they tend to wake up early, or they start to wake up in the morning feeling groggy, not feeling well, and sometimes just not feeling themselves. Some people become quite nauseous in the morning when they wake up, and they have to chase their drinking, even if they're not dependent. So that's what is first noticed. What most people tend to do who are on the road to developing alcohol use disorder at that point is they begin to consume a little bit more alcohol in the hope that it will deepen their sleep and they don't wake up early in the morning. And so the trend of increasing drinking, even in the absence of tolerance, is another hallmark of alcohol, of developing an alcohol use disorder. What other people tend to notice is once they get up, their concentration is not quite what it is. They feel all out of sorts and they begin to make mistakes. So they start trying to make mistakes at work, they tend to get frustrated, or they tend to make mistakes in their relationship, or they're not getting along with their partner or spouse. And as a result, what happens is that there is usually friction at home and friction at work, and that tends to lead to more and more drinking. That then makes the drinking tend to become more secretive. It tends to then leave the house to get into bars or places where alcohol is more readily available cheaply, and then the person is well on the way to an escalating pattern that will eventually lead to a full-blown alcohol use disorder. As everyone who's been in a relationship knows, it's very difficult when there's more bickering and fighting to be able to say that it's specifically due to one factor. What usually happens is if a person is drinking excessively, the other partner begins to notice, and then the other partner may sometimes try to put checks on further drinking. That leads to very specific type of quarrels around drinking and drinking behavior, and these tend to be the most pernicious in the relationship. There is discord in the relationship, there's a breakdown of the marital relationship or the sexual relationship, and even if a sexual relationship is attempted, what can happen is the man is more likely to have an erectile dysfunction or is unable to quote unquote perform satisfactorily, and that leads to further misery in the relationship and a deepening of the rift between partners.